The importance of baseline. One of the simplest and most powerful concepts in developing nurse brain is understanding a patient's baseline. A finding can only be fully understood in context. What is normal for one patient may be abnormal for another. A particular blood pressure may be typical for one individual and concerning for someone else. One patient may naturally be quiet and reserved, while another is normally talkative and engaged. A patient with a chronic condition may have laboratory values that differ considerably from standard reference ranges. Experienced nurses learn to establish a picture of the individual patient. How does this person normally look? How do they normally communicate? How do they normally move? How much do they normally eat and drink? What is their usual level of alertness? What does their breathing normally sound like? What is their typical pain level? What behaviors are normal for them? Once a baseline is understood, change becomes easier to recognize. A seasoned nurse often develops an awareness of change that is difficult to teach through a checklist because it comes from knowing the patient as an individual. The nurse begins to recognize not simply whether a finding is abnormal in general, but whether it is abnormal for this patient. Seeing the whole picture. Nurse brain develops when nurses stop viewing clinical information as isolated pieces and begin seeing relationships. Consider a patient who is more tired than usual. Fatigue can have many explanations. It may be related to poor sleep, pain, medication, emotional distress, illness, dehydration, or countless other factors. Fatigue alone does not tell the nurse what is happening. But suppose the patient is also eating less, has produced less urine, has become mildly confused, and has a subtle change in blood pressure. The nurse now has a different picture. The important skill is not simply recognizing each individual finding. The skill is recognizing that the findings may belong to the same story. This is why seasoned nurses often appear to move quickly from observation to concern. Their thinking is connecting information that may take a newer nurse longer to recognize as related. The development of expertise described in nursing scholarship, including Patricia Benner's work on movement from novice toward greater levels of clinical expertise, helps explain this progression. As nurses gain experience, they can develop increasingly sophisticated ways of recognizing and responding to clinical situations. Experience changes not only what nurses know, but also what they notice and how they understand what they see. That development is central to nurse brain. Nurse brain is not guessing. The word intuition is sometimes used to describe what experienced nurses do. A nurse may say that something just didn't feel right. While that experience is real, it is important to understand what intuition should and should not mean in nursing practice. Nurse brain is not permission to make assumptions. It is not a reason to ignore objective findings. It is not a replacement for assessment, clinical guidelines, evidence, consultation, or appropriate escalation. Instead, a sense that something is wrong can be an important signal to investigate further. The experienced nurse may recognize a familiar pattern before consciously identifying all of the individual clues that created the concern. That recognition should lead to careful assessment and reasoning. Notice, investigate, connect the findings, determine what they mean, act appropriately, reassess. In this way, intuition can become the starting point for clinical reasoning rather than the substitute for it.